and involve all kinds of organs far removed from your intestinal tract. That's why exhaustion is a big symptom. There are others as well we're going to talk about in a second. So, Tony, you took the saliva test earlier. What did you find?
I found that my saliva first feathered, and now it disappeared. It almost looks like there's nothing in here. Took it yesterday morning. I did the same thing, and it dropped. First thing in the morning, my saliva just dropped to the bottom of the glass. I know why I'm exhausted now, because, you know, just judging by the reaction of spraying that, I do have a terrible sweet tooth. I'm always tired, feel very exhausted. I just thought it was because, you know, I'm running around with my kids, I work, take care of a home. I just thought, you know, it's just part of life, you know.
I love that. You say it's part of life. And that's how we think about it. Especially women do this. You'll minimize your symptoms. It's not part of life. You're not supposed to feel exhausted and tired just because you have kids and just because sometimes you got to work long hours. You're supposed to still feel energized by life. And that's why I think a lot of folks are missing this very common diagnosis. And it's not just fatigue, although you mentioned that. There are lots of other symptoms that are associated with this. And this overgrowth that I'm talking about can manifest itself in ways that you have to know about or you won't diagnose the problem. So, Dr. Bowen, walk us through the typical symptoms that folks face.
Yeah, when patients come to see me and they have recurrent vaginal yeast infections, or maybe they have athlete's foot, or they have irritable bowel syndrome, or itchy skin, itchy scalp, itchy ears, itching in the anal area, or they have bloating after they eat. Those are all signs of yeast overgrowth. So if you have 2 or more of those in the last 3 to 4 months, you really want to think about yeast.
I never realized that it was that wide. I mean, I knew of exhaustion before the show, but I never put all those other pieces together that so many of you ask me about continually. And now the pieces begin to come together. So do you experience any of the other symptoms?
You know, I do get athlete's foot, but honestly, I thought it was from getting pedicures. Or, you know, I do exercise. I thought maybe I wasn't wearing the right socks, maybe not the right sneakers. So, you know, I would have never thought that it could be from yeast.
So how many women, I mean, you have a huge practice.
Yeah.
How many women really have this problem?
You know, it's very common. It's not life-threatening, but it's very common. And it causes a lot of this mental fogginess and fatigue and exhaustion and craving for the foods we shouldn't eat.
Well, I'm hopeful that this saliva test helped you and many others in the audience, but there's a guest we have today, Sheila, who discovered that yeast was to blame for her exhaustion. Welcome to the show, Sheila.
Hi,
How'd you
thank
make
you.
the discovery?
When I gave birth to my first son, I was exhausted, I had fatigue, memory fog, memory loss. I'd have conversation with somebody, forget what I was saying or lose words. So I went to the doctors and, you know, explained to them my symptoms. So they did, you know, variable tests. I was tested for Lyme's disease, which I always came out negative for. And they pretty much diagnosed me with mommy brain, exhaustion from being a new mom. Yeah. So finally, a few years ago, I went to a clinical nutritionist, and she had diagnosed me with severe candida yeast overgrowth.
Dr. Bowen, why is it that Sheila and so many others go from doctor to doctor looking for a diagnosis, which appears to be pretty common, and it gets missed?
Well, you know, I think doctors are not traditionally trained to look for yeast overgrowth. And if they find it, they often don't know what to do about it. Because as we were talking about, diet really has a big influence on the balance of flora in your digestive system. And unfortunately, most doctors aren't given enough nutrition education in medical school. So they can't really use food as medicine, as we're doing here today.
So I want everybody at home to take the saliva test tomorrow morning as soon as you get up. And if you think you have a problem, I want you to look at the symptom checklist at DrOz.com. It's really clear. And I tell you, you're going to be checking off boxes, and it's all going to light up in your head as you're going to say, finally, I figured out what is wrong with me. And guess what? It's easy to manage.